everybody. Welcome to Nurse Pod Real Talk, our second episode of this Q&A. And I'm super excited. I'm here with my friend Shawn.
Hello, everyone.
Yeah, how did we meet each other?
So me and Vincent met at UC Davis. We were both in very creative undergrad programs there. I was studying film. Vincent was studying journalism. And we had taken a intro to documentary filmmaking class together. And we created a few bits of video, some projects, and we've become friends ever since. And through our own life journeys, both of us ended up in the field of nursing, and we've still kept in touch. And Vincent's finally joining us back in the Bay Area. I'm sure everyone is happy about that, all his friends here.
We took a documentary class back in 2010
Yes.
or something like that, way back when. So I was in this position where I came into Davis at UC Davis as a science major. I was coming into as a bio major, but I wanted to switch over to something different. So I switched over to English, and then I decided to apply to a documentary production course, thinking that it would help to enhance my storytelling. That's when you and I met.
Yes.
Yeah, that's where you and I met. And what was the first project that we worked on? Do you remember the first project that we worked on?
It was focusing on mise-en-scène.
Mise-en-scène, okay.
Which was foreground shots, background shots.
Right, yeah.
And we had made a project that kind of revolved around a paper airplane. And we filmed that paper airplane at this park, and then eventually there was a group of kids that ended up joining our photo shoot video project, and it was a very small and very cute project, and from there we kind of expanded the various projects we did, including Dinosaur on Campus. I'm sure you can find out on YouTube still on Vincent's page, but my friend Luigi was the dinosaur, and kind of made a mockumentary and kind of being a dinosaur on campus. And so we made a few little smaller projects like that. And I think our original heart was in the creative fields, and eventually we ended up in healthcare. So very non-traditional path, but I think a lot of nurses follow very non-traditional paths into the field. So,
but then you and I kind of, after we graduated, we haven't really spoke.
Yeah,
for a couple of years,
maybe peripherally here and there, but we haven't really. I think I did visit you when you were over in the East Bay a few times, and we did get some food, right, but not to the same level that we were hanging out in Davis.
I remember I left a Facebook message, or I updated my Facebook status saying I'm currently applying to nursing school. Does anyone have any recommendations or something? I was asking for help about nursing school applications. And then you came in and you actually say hey dude, I'm actually applying to nursing school too.
Yep.
And then that's when we both linked up.
Correct.
Yeah.
Yes. So we came back again.
Yep, pretty much. So here we are as nurses now. So why don't you tell us a little bit about yourself? What are you currently doing now? What's your story, and what led you into nursing, especially coming from such a different trajectory? Why don't you talk about how that process went?
Yes. What am I doing currently? So I'm currently over at a academic hospital working in an inpatient setting in the North Bay, and I work as a nurse case manager. So I don't think the general public knows about that role unless you do have a family member that is getting a lot of care at a hospital or even in the outpatient setting. It's a role I didn't really know existed until I did my master's program in case management. It's a very unique role, and it's pivotal, especially in a healthcare system as complicated as in the United States. Maybe in other countries the role is maybe more simplified due to various reasons or another, but at least in the United States, you definitely need my current role to effectively move people through the healthcare system and get the care they need at the right time, right place, and utilize resources properly. So it's a very, very interesting role that I find to be rewarding, but very challenging at times. In terms of my journey, so in my undergrad studies, my mom got diagnosed with cholangiocarcinoma, which is a bile duct cancer. And throughout her disease process, she progressively got more and more sick, and her diagnosis eventually was terminal. And navigating the healthcare system with my mother at the last year of her life, I think kind of centered my focus on becoming a nurse. And I didn't know it then, but at that time, I eventually took on the role that I wish I had known at that time for my mother. And she was diagnosed before the Affordable Care Act was in place. And people don't really realize now, if you didn't grow up before the ACA or you weren't really paying attention to how people were affected by the Affordable Care Act and before the Affordable Care Act, but if you had been diagnosed with a cancer diagnosis or any diagnosis that a health insurance company might deem to be not financially the best to cover, people got dropped from those plans, and people were left without care. At that time, my mom had Anthem Blue Cross insurance through her employer, and eventually she had to get laid off, and then she was still paying for that plan privately. But when she got her cancer diagnosis, that's when she got dropped from her insurance plan, and that's when, especially when you have a chronic diagnosis like cancer, you can't go without care. There's so many things that need to happen for you to continue to receive care. So, and that's when luckily the state came in with Medi-Cal insurance and provided coverage. However, if you saw the bills that she accrued over that time, it was millions of dollars. Yeah. Eventually, I took on a role that I wish I knew again before my mom got diagnosed. So, but that's the current role I now do at my hospital.
Yeah, that's so interesting because my journey into nursing is quite similar to yours too, where it sort of stemmed around a loss of a loved one, where I was a caretaker for somebody at the time who was very close to me, and honestly, it was the Affordable Care Act that kind of helped her to continue her, some of her chemotherapy treatment, right? Because prior to then, she was using Cobra.
Yes.
She had some that was left over, and so she was able to utilize that insurance. But then, fortunately enough, Affordable Care Act came into place, and although her medical bills were still extensively expensive at the time, but it was enough to kind of it was a lot better if it didn't happen. Correct. So, but me as somebody who's at the bedside, like I really have no idea of what's going on behind the scenes.
Yes.
Right. Like in terms of insurance, like who's paying all this, like I have no idea what's going on. Right. Like I just wish things were a lot easier. I just wish like we can just provide this type of care, but I don't really know all the different avenues that it takes to orchestrate, the money behind the finance, all these different things. Right. Like that was completely a total new concept to me. And really it still is today because I don't work behind that scene. So it sounds to me like because of your own personal experience, you sort of saw what happened with your mom. You wish you were, I guess, more knowledgeable in learning how to manage these different insurance, and so that what's got you into case manager at this point, right?
Correct.
Right.
Yes.
So how did you lead to that? Like, what was your, I guess, pre-nursing / nursing education? What was that like for you?
So, studying film, I didn't really have any of the prerequisites to get into a nursing program, and I wanted to do it as quickly as possible at that time because I knew that I had to do something clinical. I knew I needed to do the prerequisites, and I knew I needed to volunteer to be able to learn more about the healthcare system and just to make myself look like I wanted the role of being a nurse. I was putting my heart and effort into getting there. So what I did was I had enrolled in a post-baccalaureate program over at CSU East Bay. Highly recommend it if you're thinking of a career change. I know many people who've done that post-bac program for dental school as well as for med school, and they've gotten into very good medical schools and dental schools. And I did it in a kind of more open-ended post-bac, so I got to pick and choose what I wanted for my classes, which were all the prereqs. And I was also working as an EMT at that time, so I got my EMT license right after I completed my undergrad, and I started working for a private EMT EMT company. So, and I worked critical care transport, which is where it's 2 EMTs and 1 nurse, and you provide care to very complicated patients. And you have telemetry patients, you have patients on vents, you have patients on ECMO, you have patients on VADs. We did a lot of pickups from SFO, Oakland Airport, from San Jose. We picking up flight crews because a lot of flight crews couldn't land on top of the hospital, so they had to get picked up from the airport. So we would provide the transportation for those patients, and we weren't providing any of the care necessarily. We were essentially kind of a taxi for the crew that came with the patient. But you got to meet these flight nurses, you got to meet the flight paramedics, you got to go into very unique environments. So you got to go into airport environments. We actually had to drop off a patient on a flight back to Tokyo, and we got to go into the airport. We had our ambulance park outside of SFO. They had bomb sniffing dogs come by because you're not supposed to leave any vehicle by SFO. And then we had to take the gurney into the airport. We had to go through the checkpoint like any other person. We had to take off our boots and all our gear. Like, you have so much gear as an EMT. And then we had to eventually put them on a separate stretcher to get them into a flight going to Tokyo. And that was accompanied by a nurse from Japan and a doctor from Japan. So there's very unique situations. So I highly recommend, if you're considering the field of nursing, to go the EMT route. I definitely think it gives you a very wide set of eyes into the healthcare environment. You go into clinic settings, you go into skilled nursing facility settings, you go into airports, you go into, so so I did that, and I was doing my post-bac at the same time, and I was working graveyard shifts from 7 p.m. to 7 a.m. As an EMT, and then I would go shower at home, hit the road, drive from San Jose to Hayward, and did my post-bac classes. So I essentially worked full-time graveyards. I was able to study between calls, and I finished my post-bac over at CSU East Bay. And then I was volunteering at 2 clinics, one in San Francisco and in the Mission District, Clinic by the Bay. I highly recommend, if you are considering volunteering, Clinic by the Bay in San Francisco is an amazing clinic. We worked with doctors, nurse practitioners, translators, diabetes educators, pharmacy, helping people get prescriptions that couldn't afford prescriptions. So you got to see healthcare in a very clinic setting, and you got to help people that had no insurance, who were underinsured, that necessarily couldn't speak English. So again, healthcare is such a small world. You'll see people throughout various settings, and it's always good to have these relationships, have these people that know you, and then they can provide letters of references, and then because those letters of references are so important when you apply for nursing school.
Wow. Do you ever take breaks, Shawn?
Sorry.
Like, you're like either going to school, you're either working graveyard shifts, you're like either volunteering at multiple places.
I slept in my car a lot. It was a year and a half. So I just grinded like 3 years of work in a year and a half because I wanted to get it done. I was like, I'm gonna get this done before 30. So I had a timeline. I was very dedicated, and that hard work showed. So
It did.
Just know people will see your hard work and they will appreciate that, because healthcare is all about the work you put in.
Right,
So.
right. Shawn is a living example that you can start into the nursing profession no matter what age you are, what experience you have, right? And, both of us came from a very non-traditional route. So I think that's why both Shawn and I, we really connected a lot, because we came from different, but also very similar like life experiences, which I think brings so much into the nursing profession. Oftentimes when the general public think of nurses, we often think of bedside nurses, right?
Yes, and they are the backbone of the hospital.
Right, and
or the healthcare system at large. They are. I would consider the backbone, and the doctors are also very much the backbone. And those two make the hospital. Without those two, you do not have a hospital or healthcare in general.
Correct, and like even more so, like even during like this pandemic, oftentimes when the media portrays nurses, they usually portrays like the bedside nurses, taking care of the patients and facilitating all this. But, I like to also want to focus on some of the unsung heroes like case managers, right? Because they're also equally as important of making sure that patients are having adequate resources once they get discharged. So I guess my question is, when I first started into the nursing career, I had no idea what a case manager is. In fact, I think the first time I heard the word case manager was when I spoke to you and I asked you, what are you doing at your institution? Like, what are you studying to become? Like, I know you're studying to become a nurse, but then you were throwing like these different types of terms. You said, I'm studying to become a case manager. It's like, what the heck is that?
Yeah.
What's a case manager?
And I was very much the same way until I applied to my program, and then I actually did.
Then you actually did.
Yeah.
But for those who don't know what a case manager is, can you maybe elaborate in such a way that people who don't have much experience with nursing or the medical profession can understand what a case manager is?
Sure, yeah. And a case manager, I think it's specific to the environment in which you work. You have the inpatient, outpatient, and you have the insurance and workers' comp side. So there's various settings in which a case manager can work. We interface with case managers in every environment, but I'm going to focus in on the inpatient side because that's the area of focus that I'm currently in. And as an inpatient nurse case manager, a good analogy I consider is we're kind of like the guys in the tarmac at an airport holding up lights, pointing the airplane in a certain direction. And for our case, the runway is for our patients, and the direction is where they're moving through the healthcare system. The focus of a nurse case manager is focusing on a safe and effective discharge plan to make sure a patient has all the tools and resources they need to be able to go home or to another setting, a skilled nursing setting, a long-term acute hospital, subacute setting, and they can thrive or progress back to their baseline, and making sure that they don't unnecessarily need to go into the hospital unless they really need to. So we are the linkage between the inpatient and the outpatient side, and we focus on making sure we have a safe and effective discharge plan for patients. And especially with COVID, we have talked about we don't have enough beds, we don't have enough staff, there's too many patients. Again, it's the case managers and the social workers that are working behind the scenes to make sure people are moving as smoothly and effectively through the system, and making sure that they have the resources, making sure they're connected with insurance, making sure insurance is communicating with us, making sure we can push back against insurance that is trying to make one of our patients leave before they necessarily are ready. And sometimes even, this is the worst part of a case manager's role, is a patient who doesn't want to leave the hospital but has a safe and effective plan to leave the hospital, we can get them to another location, even though they might necessarily like to leave the hospital.
Right.
Some patients just don't. They love the care that they receive in a hospital. It's the best care they will receive. So, but sadly, the hospital is more of a place where we stabilize you, the doctors and the nurses stabilize you, and we can get you safely to a lower level of care. I know some people may consider that some of the and antithesis to our role of a patient, but again, we're providing a way for the system to work as effectively as possible with a limited amount of resources available, and making sure people do have a bed when they're sick or they've had something happen to them and they don't have to wait in the emergency department for hours or days, and sometimes even weeks during this pandemic. So our role is to make sure the flow of patients moves as effectively as possible.
What do you think are some challenges and also rewarding aspects of your role as a case manager?
We interface with the patients and families, I think, in a way that's very holistic. We kind of understand them personally. We understand their family situation. We understand how they were before they came into the hospital, what their goals are in regards to leaving the hospital, what settings they want to be going into, and our job is to let them know the truth of what they can and can't do by the system at large. And so it's rewarding in the sense that we are one of the best advocates for our patients. We give them a sense of what is possible and what's not possible, what costs a family, what doesn't cost a family, what's covered by insurance, what's not covered by insurance. And we very much work with our doctors to kind of give them a sense of what is possible. And I think working in a teaching hospital, I think a lot of younger doctors and intern physicians, they have a very bright picture of what the healthcare system should be, and they think the services may exist, when in reality those services are either limited for one reason or another, whether insurance or cost or geography plays a very big role. If you're from an urban versus rural environment, there's different types of services, what can be done at home, what can't be done at home, what can be done in one location versus another location. We are there to provide the barriers to provide care in these various settings. So we're kind of the guys with the little sticks on the runway, just to guide not even the patients, but also the various members of the team. Some of the challenges is a hospital is the highest level of care, especially tertiary level hospitals is the highest level of care a patient can receive. You get all the specialists you need, you have all the peripheral staff that can provide for you. You have the best physicians, the best medicine, the best procedures and techniques, and that allows patients to live and thrive in a hospital environment. But sometimes the beauties of medicine causes limitations outside of the hospital. So patients that have tracheostomies, that need dialysis, those are the toughest patient population you can get placed outside of a hospital, especially during COVID. So a tracheostomy is an opening in your neck that allows you to breathe due to one reason or another. You may have some type of mass, or you have some type of anatomical issue that requires you to have a tracheostomy. And you also need dialysis. Your kidneys are not functioning to remove waste from your body, and you need to go to dialysis 3 times a week, but you have this chronic respiratory issue. And that's a dialysis clinic is a clinic that does not have as much support as a hospital does. So you can't replicate these environments so easily. So there's very few and far between to get the patients the care they need outside of a hospital. So these patients may either stay at a hospital for a very long time, or we have to send them far, far away to find a location that meets their needs, which takes them away from their family, that takes them away from their support system. Because sadly, there's such limited options. So that's the various challenges that you have as a case manager. You're trying to do right by the patient, but the system might dictate what you can and can't do.
So a lot of people who are going into nursing, primarily when I go into nursing, one of the most important thing is finding that work-life balance. Now, I know a lot of bedside nurses, typically their schedules are either, it's 3 days or 3 nights a week, depending on how those 3 shifts are consistently, being scheduled. But you as a case manager, it sounds like you work pretty much the entire workday, the entire weekday, right?
Correct.
So what has that been like for you, like that work-life balance? I'm sure a lot of people who are interested about case manager, they want to know if it's conducive to developing a healthy work-life balance. So what has your experience been like?
Yeah, so I'm a Monday through Friday, typical work hours. So I do usually 8 to 5 or 9 to 6 for my hours. I'm an exempt employee, so I'm salaried. I don't get overtime. And I do 5 8s a week. We're exempt, so we don't clock in or clock out. We can leave whenever work is done, or we can stay as long as work needs to be done. So there is definitely more days than not where you spend more than your typical 8 hours, but there's also those occasional days where you leave like an hour early. So especially if you're very efficient with your work, you probably can get all that, but there's things outside of your control where you do have to stay longer. Some other case managers do work either 0.75, so 3 10s, or they work full-time, which is 4 10s. And it's a job share position. Usually you'll share your job with another person. So you have the same cases, but then you have to hand off to your colleague that's going to take off your role. Versus me, I don't really hand off unless it's on the weekend, when I'll hand off my cases to someone else. So I'm the primary case manager usually during the week, unless I take paid time off. So in that sense, if you like your weekends, healthcare usually has you take on random weekends here and there. We have to do X number of weekends per quarter. So in that sense, you may like a Monday through Friday schedule and with the weekends off. So and if you get lucky, you can get a job share position and work 3 10s or 4 10s. So especially for people who have children who may want to spend more time with their children or just value their free time more, you can do one of the job share positions.
What do you think are some top 3 qualities that these likely candidates should have?
I think the number one skill is being very personable, being very empathetic, putting yourself in the other person's shoe. And if you were that person making the same decision as them, what do you want to do? Especially if the case manager knows the path forward for you. And the case manager's role is to educate the patient and family on the various paths. There's so many different paths you can move through a healthcare system, and your job is to provide those options, provide the pros and cons of each option, and have the patient empower them to make that decision that works best for them and the family.
So no, that's interesting. So you're like a liaison. The thing is, like, I always come to case manager when it comes to seeing beyond discharge, right? And that has always been kind of a curiosity for me, since most of my experience as a nurse has been solely by the bedside. So I don't know what things look like for these patients once they get discharged, right? Because my care is so structurally different than from your care.
Correct.
Right. So it's interesting to kind of see that from your perspective, is like discharge planning happens the moment they get admitted.
Correct.
And figuring out all the different resources available in the hospital as well as outside of the hospitals to make sure that they're being taken care to the best of our hospital abilities during bedside and post bedside.
Correct.
So,
and the goal of a case manager is to provide the right care, the right place, at the right time, and also a big goal of an inpatient nurse case manager is reducing readmissions. Because a readmission just means that whatever plan you had in place has failed in the outpatient setting. And it could be for many reasons. It could be just because of the disease progression, not enough social support, not enough understanding of what the care plan was, not enough education. So your goal then is to reassess what had happened and figure out what to do from there. And when you had a complicated patient that took a while to leave the hospital, but then they never come back, and that's a success story, especially for patients that had a lot of difficulty on leaving the hospital. I think that's a person that can thrive at home is going to be doing a lot better than a patient that may be staying forever in the hospital and relying on other people to take care of them. So, and there's also like a psychological benefit of leaving the hospital, leaving this environment that's very noisy, and you have strangers every day, and you have to learn new people's faces, and you become delirious, and so there's a lot of downsides to being in the hospital as well. So,
All right, Shawn. So last question. Okay. All right. So let's say you build a time machine. Okay. You built a time machine. You got into that time machine, and you flew back in, I don't know, like 2016. When was your first semester in nursing school? What year was that?
I think it was 2016.
2016.
Yeah.
2016, 2017. And you meet first semester student nurse Shawn. Okay. What advice would you give to that version of 2016 Shawn? What would you say?
I think keep your momentum going. Work as hard as you actually did to get to where you are now. I don't know what I would. I don't think I would need to say much. Maybe spend a little less of my student loan money. But I think having discipline, motivation, curiosity to keep learning, saying yes. I think saying yes is very important to stick out in your nursing cohort. Getting yourself to fight for those positions you want. You want to work in the ICU, you want that internship in the ICU, you want to work in that hospital that you would really want to work at, fight for what you want. Stick out from your colleagues. Even though you love your colleagues, you hope you do well for them, there's only so many spots at particular institutions, and especially if you are keen on going to one institution over another, there is some sense of competition in those spots. And you may get lucky and you don't have any competition, but I think friendly competition is always good. They're your colleagues, your friends. You're going to be working with your colleagues for a long time, and they're going to be your network to find jobs after you graduate. So build those relationships that will last a lifetime, because again, healthcare is a very small world. You want to never burn any bridge. You want to be friends, and you want to make sure you present yourself well, and people can trust you. And people can rely on you, and you can be a good resource for others. I think having those traits in healthcare is very valuable, since it's such a difficult task to endure on your own, and having people who've done the same path as you did, understanding the same struggles, provides that camaraderie to kind of make it through and do well. And again, nothing wrong with friendly competition. Ain't med school. There's no curve, or pre-med. There's like no curve. So once you're in, just.
I think if my nursing school had a curve, I would have failed anyway, because everyone's smarter than me. No, well said. I think best advice too is just don't afraid to be. It's okay to fail, right?
Yes.
So take those chances, seek those opportunities. If you're a new grad and you want to get into a specific specialty, go for it. Send out those resumes, send out those cover letters, reach out, know your network, because the worst thing that can happen is you not trying.
Yeah.
Right.
And you're only in nursing school once.
That's right.
You're just in nursing school once, so give it all you got. You're only there once. So make it worth it.
Right, unless you plan to go to grad school like this guy. Yeah. But yeah, you're only there for once. It's only a short amount of time of sacrifice. but it's so worth it. It's probably the best time to get into this profession because so much of healthcare is continually evolving. I think the pandemic kind of took its toll,
Yes.
right? It really created a restructure of how different hospital policies are happening. So there's a lot for changes, and there's a lot of rooms for new ideas, for fresh ideas, for new nurses like myself, like Shawn. Anyway, so if you're interested in learning more about Shawn, feel free to subscribe to this YouTube channel.
Yes.
I'm definitely gonna feature a lot of Shawn more in the future because he's one of my closest friends here in the Bay Area, and I always learn so much learning from Shawn.
No, I learned a lot from Vincent in terms of art, filmmaking.
Thank you.
Nursing.
Yeah, so Shawn and I guess we should have said this a lot earlier, but Shawn and I, we're always interested in finding ways to integrate creativity into healthcare. I think for me, having this YouTube channel provides that place to allow these creative ideas to flow. And Shawn, is there anything that you're currently working on, or what are some things you like to do outside of healthcare?
Yeah, so I've been focusing on fitness. I think that's a way to prevent burnout, to build yourself up, make sure you're healthy, eating well. Nursing is the long haul. This is your career. This is going to be your life. You need to make sure it's sustainable. So nutrition, fitness is very important. And also creativity, I think, is also important if you come from like a creative mindset. So I do photography on the side, and I'm working on a film project currently. So there's things that you can do you have the freedom to do things outside of work. That should never stop you. You shouldn't let being a nurse just be your only identity. I think it's an important identity as a person, but I think you should have other things that you can focus on, other hobbies, to get yourself away from work, and focusing on your well-being, your mental health. Recommend therapy. I think therapy is really good to deal with the stresses of life, and in general, I think everyone should start therapy. So definitely make a very robust type of plan for yourself to sustain yourself long term. And again, it's fine to be burned out. It's fine to call in sick when you're not feeling well or your mental health is deteriorating. It's fine to take care of your body, get massages, go to the chiropractor, do acupuncture or cupping or whatever you need to do to take care of yourself. You should spoil yourself from time to time, and not always be the one that provides care for others, but also care for yourself.
Yeah, well said. Keep in mind that nurses, we're not robots taking care of humans. We're humans taking care of humans. So it's always important to really focus on that holistic wellness, like you said, like outside of just Western medicine, but also thinking about complementary medicine too.
Correct.
Right.
Correct.
So that's it. That's Shawn. Thank you, Shawn, for coming into the Nurse Pod Real Talk. Definitely learn a lot. And again, if you love what you see, feel free to like, share, and subscribe. And until next time, I'll bring in my next guest. I don't know who. I'm literally just like, I've got like names on a hat that I'm picking out, and we'll see where it goes from there. But thanks a lot, Shawn. And
all right, thank you, everyone. Hopefully I wasn't too awkward in front of the camera.
I'm